Postnatal family planning, contraception. How to stop getting pregnant again soon after having a baby. It is safer for you and your next baby to wait at least 2 years before becoming pregnant again after you have had a baby. Your body needs time to recover after childbirth. If you get pregnant again in the first year after giving birth, it is more likely that your next baby could be born too early, be too small, or even could not survive. Remember, it is possible to get pregnant as soon as 21 days, or 3 weeks, after having a baby, and even before your first period after childbirth. And it is possible to get pregnant whilst you are breastfeeding. To stop getting pregnant, you need to use contraception from day 21 after giving birth. However, it is often better to get your contraception started before you leave the healthcare facility after having your baby. Most methods of contraception can be started safely straight after birth, and most methods are safe for you and your baby when you are breastfeeding. Long-acting methods of contraception are best at stopping pregnancy. These include implants, which are put just under the skin of the arm, or IUDs, also known as the coil, spirals, or loops, which are placed in the womb within the first 2 days after birth, either through the vagina or at the cesarean section, or from 4 weeks after birth. When implants and IUDs are removed, it is possible to get pregnant again, straight away. This means they can be used to space out your pregnancies. Some other hormonal methods, such as pills, patches, and injections, can be restarted at different times after birth. This can depend on several things, so check with your healthcare provider and they will advise you. Breastfeeding can help to stop pregnancy, but this works well only if your baby is less than 6 months old, and you are giving your baby only breast milk, and you haven't had your first period since giving birth. If you have longer gaps between breastfeeding your baby, your risk of pregnancy also goes up. Some methods of contraception can be used after having sex to help stop you from getting pregnant. These are called emergency contraception methods. They are safe to use after having your baby and when breastfeeding. Condoms are the only method that protects you against HIV and other sexually transmitted infections, and they can be used together with any other contraceptive method. Methods which use period monitoring do not work soon after having a baby. You need to have at least 3 normal, regular periods first. All of these methods of contraception are much better at stopping pregnancy than using your periods as a guide to work out when you are less likely to get pregnant. It is best to think about contraception and plan it whilst you are still pregnant. Then you can get postnatal contraception at the healthcare facility after you have given birth. Ask your healthcare worker about which methods are available to you and when and how you can get them.